When the car uses the ramp, and the patient will be taken out from the car here, from this main door.
Patrick MORLU is helping construct this new Ebola holding centre.
Yeah.
It's where patients with symptoms can be quarantined until they are tested.
And here the car will come, and then they will open the door. Before then they will go in here. But this place is mostly for the nurses. This place will be for the nurses, where they will be having their chemical and so on. Here we will keep the suspected patient. The suspected patient will be here, and this place will be used for their bathroom. Okay? This place will be used for their bathroom.
It's taken 5 weeks to build this 12-bed holding centre from scratch and costs more than $60,000. The money, the materials and the manpower donated by the private sector, specifically one company, ArcelorMittal. The steel and mining group operates a huge iron ore mine about 30 minutes drive away. It's there that Patrick Johnson normally works, building bridges and roads. But this, he admits, is one site he would prefer not to see used.
For me right now, I didn't even want any patient or any Liberian to go in there. I would rather turn this building over to the health team to use it for other purposes. But then right now we have to do it because we want to contain the situation. Okay, as I said before, for the company, I feel happy to do it on behalf of the company and on behalf of our nation.
This clinic is being built on the site of the biggest local hospital, but before its construction, there simply weren't any places for Ebola patients here in the whole county. In fact, they'd have to be driven 8 hours towards the capital, Monrovia, for treatment. Now, there are beds in the county for Ebola patients, but without private sector funding, these clinics simply wouldn't have been built.
No, we never had the means, we never had the funders, we never had the money to build these structures. No. So, I mean, the coming of ArcelorMittal was a huge relief to the county health system. But what the challenge is now is who manage these centers. And so currently, like the one we have at the Ganta Hospital now, we have the staff there. They have been trained, about 31 staff currently working at the ETU in Ganta, but we are in need of partners that will help to run it.
Liberia's own healthcare system is stretched already to its max. Funding for the running of this clinic could well come from the private sector. A new group of 30 West African companies operating in the region has pledged to fight the disease. By giving funding and support to local communities and the government, they want to end this virus as quickly as possible. Katerina Vittozzi for CCTV, Sanakili.